Welcome to the deep dive. Today, we're tackling a really vital area for anyone in healthcare or thinking about it, pediatric nursing.
That's right.
Whether you're deep in your nursing studies right now, maybe thinking about a career shift, or, just want to understand how we care for infants and children, this deep dive is definitely for you.
Absolutely. We spend time really digging into a foundational text, Perspectives of Pediatric Nursing. It's from Wong's Nursing Care of Infants and Children.
Classic.
It really is. And our mission today is to pull out those key perspectives that really guide this specialty. Think of it as getting a solid handle on the essential goals, the main principles, and, well, the incredibly varied role of a pediatric nurse.
Okay, great. So let's jump right in. What's the big picture when we talk about children's health? What are we aiming for?
Well, the main goal, and the source really stresses this, is promoting and maintaining the best possible health for all children, not just some, all of them.
And that's more than just like fixing problems when they pop up.
Oh, much more. It's really about fostering overall well-being, physical, mental, social, the whole package.
So how does pediatric nursing fit into achieving that broad goal?
Pediatric nursing takes a very proactive stance. It's really grounded in health promotion, actively encouraging healthy habits, trying to create environments where kids can thrive.
Okay.
And it's also huge in illness prevention. Think immunizations, education, that sort of thing. And crucially, it's about delivering care that's holistic and family-centered. Because a child's health, it's so tied up with their family's well-being.
That makes sense. Now, the source brings up morbidity and mortality. Why are those specific terms so important as indicators?
Right. Well, morbidity, that basically tells us about illness rates. How often are kids getting sick in a population?
Okay.
So we look at things like how many kids need hospital care, how often they miss school because they're sick, how many doctor visits are happening, common culprits for morbidity. Things like asthma, bronchiolitis, infections, and sadly, injuries are pretty high up there.
Got it. So that's the illness side. What about mortality?
Mortality focuses on death rates. And a really critical measure here is the infant mortality rate. That's the number of deaths in infants under 1 year old per 1,000 live births. It's a really stark indicator of a population's health and, frankly, how well the healthcare system is working for the most vulnerable.
And what are the leading causes the source points to?
The big ones listed are congenital anomalies. Those are conditions present right at birth. Then prematurity, being born too early, SIEs, sudden infant death syndrome, complications related to the mother's pregnancy or childbirth, and again, injuries.
So tracking both morbidity and mortality really helps pinpoint where efforts are needed most. Let's circle back to health promotion. You said it's proactive. What does that look like in practice?
It's definitely a multi-pronged approach. The source outlines key parts like good nutrition, teaching families, ensuring access, promoting physical activity, getting kids moving, and then, of course, immunizations.
Immunizations are huge.
Absolutely vital. They're a cornerstone of preventing infectious diseases.
You sometimes hear debate, but the source really emphasizes their impact.
It does. Because the data is clear. Vaccines have just dramatically slashed the rates of diseases that used to be common and devastating: measles, polio, whooping cough, you name it. They've saved countless lives and prevented immense suffering. It's a public health triumph, really.
And it protects more than just the child who gets the shot, right?
Exactly. That's the community immunity aspect. But health promotion is even broader. It includes educating parents and kids, providing what we call anticipatory guidance.
What's that exactly?
It's basically giving parents information about what developmental stages are coming up, what challenges or risks might appear, and how to handle them proactively. It's about looking ahead.
I see.
And it also involves community outreach, trying to make the whole environment healthier for kids.
Okay, so that's the ideal promoting health, but reality includes challenges. What major health problems does the source identify for children today?
Yeah, the source doesn't shy away from the tough stuff. Childhood obesity is a major focus. And it's not just about weight. It connects to serious issues down the line, like type 2 diabetes, high blood pressure.
And social issues, too.
Yes, social discrimination is mentioned as well. And linked to that, there's the rise of type 2 diabetes itself in kids and teens, which is largely tied to our modern lifestyle and diets.
Those are significant physical health issues. What else?
Mental and social well-being are huge concerns, too. The source talks about violence, mental health challenges, including suicide, unfortunately, school shootings, bullying. It's a heavy list.
It really is.
Then there's substance abuse, often starting in the teen years, and also developmental and behavioral issues like ADHD, autism spectrum disorder, learning disabilities, these are prevalent and require specialized care and support.
Wow. It's clear pediatric nurses need a broad knowledge base. The source mentions the art of pediatric nursing alongside the science. Can you unpack that a bit?
Yeah, that's such a key point. The science is the clinical knowledge, the procedures, the pharmacology. But the art, that's the human touch. It's compassion. It's being able to truly communicate, not just talk at, but communicate with children of all ages and their families. And creativity, resourcefulness.
So it's not just about following a checklist.
Definitely not. You need incredible flexibility. Kids aren't little adults. Their needs change constantly. You need cultural competence, understanding, and respecting diverse family backgrounds and beliefs. And maybe above all, you have to be an advocate.
An advocate.
Yes, speaking up for the child, for the family, especially when they might not be able to articulate their needs clearly or navigate the complex healthcare system themselves.
That advocacy role seems crucial. This leads us nicely into the core philosophy of care. The source highlights family-centered care first. What does that mean practically?
Family-centered care is, well, it's everything. It's the bedrock. The idea is that the family is the constant in the child's life.
Right. Nurses and doctors might change, but the family is always there.
Exactly. So the philosophy means you partner with the family. You value their expertise. They know their child best. You involve them in planning, in decisions, in the actual care. It's a true collaboration.
Okay. The next principle mentioned is atraumatic care. Sounds important, especially with kids.
Hugely important. Atraumatic care is all about minimizing distress, both physical and psychological, that kids might experience during healthcare encounters.
How do you do that?
It involves lots of strategies, like preparing kids for procedures, using words and methods they can understand, using distraction techniques, bubbles, games, guided imagery. Pain management is key, obviously. And involving parents or caregivers right there during procedures can provide immense comfort and security. The goal is to make the experience as positive or at least as non-threatening as possible.
That makes a huge difference, I imagine. The third principle is evidence-based practice EBP. We hear that term a lot. How does it apply specifically here?
EBP, in essence, is about making smart, informed decisions. It means blending three things: the best available research evidence out there, your own clinical expertise and experience, and importantly, the patient's and family's values and preferences.
So it's not just, this is how we've always done it.
Precisely. It's about constantly asking, what does the current evidence say is the best way to handle this situation? And then integrating that knowledge into your practice. It ensures care is effective and up to date.
Which seems vital in a field that must change as we learn more.
Okay, let's talk about the actual role of the pediatric nurse. It sounds like they wear many hats.
Oh, definitely. Many, many hats. The source lists several key roles. First, the caregiver providing that direct hands-on nursing care. Then the educator teaching kids and families about conditions, treatments, health promotion. The advocate, like we discussed, speaking up for their needs.
They're often managers, too, coordinating care, making sure all the pieces fit together, especially if a child sees multiple specialists or moves between settings. And many are involved in research as well, helping to build that evidence base we just talked about.
That's quite a range. What are the core responsibilities that cut across all those roles?
Some fundamentals include supporting the whole family unit, recognizing that a child's health situation impacts everyone. A huge part is promoting the child's growth and development, watching for milestones, addressing concerns, providing direct care, both physical and emotional support, is obviously central. And that coordination piece, managing care across different providers and settings, is essential for smooth, effective treatment.
You mentioned research in EBP again. How do nurses practically keep up with new research and use it day to day?
It's an ongoing challenge and responsibility. Nurses need skills to find, evaluate, and apply research. The source points out a couple of helpful EBP tools. One is using PCOT questions. Yeah, it's an acronym: Population, Intervention, Comparison, Outcome, Time. It gives you a framework to ask really specific clinical questions, which makes searching the literature much more focused and efficient. Instead of just vaguely searching asthma, you ask something like, in school-aged children, P, does a peer-led education program, I, compared to standard nurse teaching, C, improve inhaler technique, O, over 6 months, T, C, much clearer.
Ah, I see. That structure really helps narrow it down. What was the other tool?
The grade system. That stands for grading of recommendations, assessment, development, and evaluation. It's a way to systematically assess how good the research evidence is, its quality, and how strong the recommendations based on that evidence should be.
So it helps you judge how much confidence to put in a particular study or guideline.
Exactly. It helps ensure you're basing your practice on solid, reliable evidence, not just anecdotal reports or weak studies.
Okay, so you have the evidence, the philosophy. Putting it all together requires good thinking, right? That's where clinical reasoning comes in.
Absolutely. Clinical reasoning is that critical thinking process nurses use constantly. It starts with gathering all the data history, physical assessment findings, lab results, what the family is telling you, the child's behavior, their developmental level, everything.
A lot of information.
It is. Then you have to interpret it, recognize patterns, figure out what's most important right now, the priorities, and based on all that, plus the evidence, you make informed decisions about what needs to be done.
And the nursing process is the framework for actually doing it?
Precisely. The nursing process gives you those systematic steps. It usually has 6 phases. First, assessment, that comprehensive data collection we just talked about.
Right.
Second, diagnosis, identifying the key problems or needs, often using standardized nursing diagnoses like NANDA. Third, outcomes identification, setting clear, measurable goals with the family. What do we want to achieve?
Okay, assessment, diagnosis, outcomes.
Uh,
What's next?
Fourth is planning, figuring out how you're going to reach those goals, choosing specific interventions. Fifth is implementation, actually carrying out those planned actions, providing the care.
And the last step.
Evaluation. This is crucial. Did the interventions work? Did we meet the goals we set? You assess the child's response, see if things improved. If not, you need to figure out why and revise the plan. It's a continuous cycle, not just a one-time thing.
That really lays out how clinical reasoning and systematic action work together. One last area the source mentions is quality outcome measures. Why focus on those?
Quality outcome measures are how we know if the care we're providing is actually effective and making a difference. They're tools for evaluation.
Can you give some examples?
Sure. The source mentions things like patient safety indicators. Are we preventing falls,
Right.
medication errors? Infection rates, are we controlling hospital-acquired infections? Patient and family satisfaction scores. How do they perceive the care they received? And of course, actual health improvements. Did the child's condition get better? Did their symptoms resolve?
So it's about measuring the results of the care provided.
Exactly. And nurses are key in documenting and tracking these outcomes. By monitoring this data, hospitals and clinics can see what's working well and where improvements are needed. It drives quality improvement and ensures accountability.
This has been incredibly helpful, really clarifying the core perspectives of pediatric nursing. We've covered so much, from the overarching goals right down to evaluating care quality.
Yeah, and I think the key threads running through it all are that commitment to family-centered care, minimizing trauma through atraumatic approaches, and always grounding practice in solid evidence.
And it really underscores just how multifaceted the pediatric nurse's role is. They're caregivers, educators, advocates, managers. It's a demanding job.
It truly is,
Yeah.
but also incredibly rewarding. And applying that clinical reasoning, using the nursing process systematically, that's what enables nurses to navigate the complexities and provide that high-quality care.
So, for everyone listening, especially if you're in or entering this field, really think about how these foundational perspectives, family-centered, atraumatic, evidence-based, shape everything. Consider how you can weave these principles into your own approach, always remembering the unique child and their family at the center of it all. Thank you for joining us for this deep dive.